That Naturopathic Podcast. TNP.
Hello there.
Hi, and thanks for joining us. I'm Dr. Michelle Pobega, naturopathic doctor.
And I'm Dr. David Miller, ND, and we hear your frustrations. This show is for you.
This show is for you if you're feeling like your current healthcare strategy is not getting to the root cause or the underlying reasons for your health.
This show is for you if you've been told that you're fine, but you definitely don't feel very well.
This show is for you if you're walking out of your doctor's office with 1, 2, 3, 4, or even 5 medications without any mention of diet, lifestyle, or a long-term game plan.
This show is for you if you've got several specialists taking care of you, but no one is really putting all the pieces together.
This show is for you if you believe that health should be part of healthcare. These problems have solutions.
We know it.
Our patients know it.
And we want you to know it.
Naturopathic medicine is the solution that you should know about. Hello, and welcome to another episode of That Naturopathic Podcast. I'm Dr. Michelle Pobega. I am flying solo today with a very special guest. She is a force to be reckoned with, her and her sister, very tenacious for truth and integrity when it comes to naturopathic medicine. And I am so grateful that she's on the show today. Please welcome Dr. Carissa Doherty. She is a naturopathic doctor in Burlington, correct?
Correct.
Yes, there we go. Perfect. All right. Welcome to the show, Carissa.
Thank you. Thanks for having me. I like
Thanks for
your
saying
work.
yes. Dave and I are like, when are we going to get the Doherty sisters on? We keep talking about this, and I finally saw you, and I roped you in. So,
and I recognize you, but then I didn't write. I'm like, I know you. I know you in this way, and I know you as a naturopath, and I know you as it was great. It was great.
Yeah.
I enjoyed the corner.
I also really enjoyed you in the hallway putting a B12 injection into my butt, which was like flawlessly executed, and I did not feel it at all. So that was amazing. It was like the best B12 injection I've ever had in my life.
So that is my claim to fame, because I'm the older sister, and my younger sister is the younger sister. She's competitive. She's better at sports than I am. She's like famous in the autism world as a naturopath. And so I'm like, I can do B12 shots the best. And so that is my thing. It is the one thing that I'm like, I am the best at this one thing.
I doubt that there's just one thing, because otherwise you would not be on the show to talk about like things that you're actually quite good at. So there's obviously more than one thing. Talk to us a little bit about what we want to discuss today. It was a topic that you had at a conference, and I found it really interesting, and that it's a lot more common than people realize. So I wanted to bring it to our audience's attention.
Yes, I'm currently obsessed with POTS. So POTS is P.O.T.S, Postural Orthostatic Tachycardia syndrome, or my heart beats really fast when I stand up. And so it was not that famous before. I saw some of it in my practice because I do a lot of Lyme patients. I see a lot of complex Lyme patients. And so I was involved with seeing POTS and then getting it into like, where do I put it into a case? Is it about killing stuff? Is it about like, where does it go in order of operations of treatment? And then COVID hit, and everyone and their dog got POTS in very significant ways. And it hit a lot of people in a lot of ways. And so it was wrapped into the ERs getting slammed with chest pain and anxiety symptoms, and in general, there was a general increase of anxiety overall that we sort of called psychosomatic, and then they were medical cases. So the keynotes for POTS are anxiety and dizziness and heart palpitations, although there can be lots of other things, but it's actually medical. So something really significant can happen to the body, and the body freaks out in a very significant way. And part of the freak out is that it's going to quarantine you from yourself. Like, oh, you're in timeout, but you're inside your own body. So what POTS does is takes an event and says, I'm going to help you survive the next moment, but doesn't change. So one of the things that happens is, instead of having blood volume that's normal, you have a shock to the body, which could be an infection, or could be, usually something medical. Multiple surgeries can suggest it or can trigger it, but the body decides that it's going to make less blood volume for you and try to quarantine the problem and keep you still, basically keep you to ground, keep you recovering in a real way, like a recovery position on the ground, flat, so all the blood can flow in a lateral way. And then you have to function. So every time you stand up or sit up, the blood has to go all the way to the head, and that's got to create a real hustle for the system. The blood vessels have to constrict, the adrenaline has to go in, lots of drama, downstream drama has to happen in order for you to stand up. So these are the people that have anxiety in the middle of the night. They wake up with their heart palpitations. The increase in heart rate is is really easy to track. I mean, if you're physically active, you're strong, your heart is a muscle, the stronger you are, the slower it beats. And then randomly your heart rate is up 20 points just for no reason. Usually that's adrenaline, and that can be a compensation for this whole piece. So yeah, usually what we're looking at is making sure that a person isn't diagnosed with an anxiety disorder when it's a medical disorder, and then making sure if you do treat them to track them. But the nice thing about where's my guy, the POTS piece is you can just take the pulse oximeter and check your finger and say like, oh, my heart rate is really high and I'm not doing anything. That's weird. You know,
it's a, I mean, you're right. Post COVID, during and post, there was a lot of people having cardiovascular like symptoms, getting full on assessments. Everything's within normal limits. The doctor's like, we don't know what to do with you. And then they would eventually come to a naturopath. And then we're also kind of like, this is weird. This is new. This is also something that a lot of us are not trained in. All this new stuff started to emerge. And I'm glad that we're actually talking about it and understanding what it could be, because it doesn't mean it's always just this, but I think that there's a really strong underlying piece of this involved with a lot of people's weird heart palpitations and tightness of chest, and that nobody could explain. And I'm glad we're finally starting to unpack it and understand it so we can support people, because it hasn't gone away. It might have been a bit more minimized outside of the intensity of what COVID brought, but it hasn't gone away. And that I find that some people still have these weird lingering symptoms. And it's nice that we're starting to become more aware of how to support this. So I remember from the talk that you kind of categorized it into three different types of possibly, if I'm correct. Great. Can you elaborate a little bit about those three types?
Yeah. So like I have little pictures on my screen. So I'm like, I got it. I'm a picture person. So one of them is the hypovolemia, which is like there is less blood volume in the person, which is very physical to sort of understand, but there's no great test for low blood volume. So, really what we would try to look at is when you're looking at low blood volume, the general symptoms of people who have low blood volume would be weakness. Like they have less blood to give them less juice and less power. So they would be weak. They would definitely have recovery issues after exercising, or recovery issues after physically functioning the day, even just sitting up and going through work, or sitting up and going through school. They get really tired. But the exercise intolerance is interesting because sometimes very significant like athletes would have this exercise intolerance. You're like, did you just become out of shape? It's so strange. It's not the way the life works. So that's the hypovolemic low blood volume. And then the solution is, not easy, but sometimes you would then try to pretend like the body is normal by putting in lots of salt. And so some of the research a couple of years ago showed that some of the volume repletion ideas could be up to like 8 to 12 grams of salt, which I would not recommend unless you are supervised and you do not have hypertension, because that is dangerous. But if you have low blood volume and you feel fantastic with a little bit of salt, but it doesn't really put you up where your normal is, you should really fake where normal is. How do you get out of this idea? Medically, the P.O.T.S diagnosis is called a dysautonomia, which means that the brain is actually changing all the rules. It's the brain that's telling the whole system, I'm now in this mode, or I'm thinking, let's do this. And it's very hard to change what the brain's mind is unless you fake normal. You're like, do you feel normal? Do you feel stable? Can you reset your values, please? Because this is not feeling good. So when you're looking at oil rehydration, you really want to fake what normal feels like for a period of 2 to 3 months at least. And then oftentimes then people could come down or even stop. Like sometimes they'd have to do it occasionally every 24 hours. And then they're like, oh, I don't have to do it every day. Oh, now I have to do less salt to feel more like normal, because their brain is filling in some of the gaps and saying, maybe quarantine was a bad idea. It seems like you're doing better. So I'll increase the blood volume over time to where normal was. So that's the hypovolemia, or the low blood volume. And then the second one is called hyperadrenergic POTS, or tons of adrenaline flooding through the system. And these people they could be extremely, like the heart palpitations are really aggressive, so extreme tachycardia, and feeling, like not only the heart rate is high, but they feel the pulsing in the chest or in the ears. They can have like a fine tremor, kind of like you've had 10 cups of coffee, like caffeine. You can have migraines, you can have hypertension, you can have low hypotension too. And this is more common with the nausea and vomiting piece. So adrenaline is a neurotransmitter, but it's also a hormone. Hits your stomach, makes you nauseous. Then that's where the gastroparesis people come in. So with that one, naturopaths are well suited for this because we have better hustles than, say, medical doctors. The drugs that help for adrenergic or adrenaline are not exactly on the adrenergic pathway, because adrenaline, to stop it in a drug form, is a habit forming drug. Like we can't really give Ativan all we want because, one, it only works for a short period of time, and two, it's habit forming, and then its efficacy decreases over time. So as a drug that stops adrenaline, there's not a nice little niche. But for herbs, there are a couple of really good herbs that are not habit forming. They're safe. You can start, you can stop them. You can high dose them at parts of the day. They're safe. They're not sedatives, so they won't make you tired, although you may feel tired when you initially are trying them. But herbs that shut down adrenaline or put them in timeout are great. And then cofactors that will cut up adrenaline and clear it from the body in a more efficient way are really the way this type of POTS responds with respect to naturopathic medicine. But there are drugs that are different. Like the drug idea, I feel, is a bit reactive and not as proactive, which just means that if someone's on a drug for POTS, they will probably have an increased quality of life, and they probably went from very physically not capable to very more functional, but then they're stuck on that drug, and they can't get off to the next step.
Right.
And so the last POTS is neuropathic POTS, which would be more loss of sweat. So it's like when your blood pools to your feet. So those people, sometimes to test them, your heart rate should be, 55 to 75, depending on how athletic you are, then it's lower. But when you're going from, say, seated to, or say, let's go from seated to lying down to standing. When you're going from lying down to standing, your heart rate should go up 10, 15 points. That's normal. Blood goes to the head. We want it to go up. That's normal. So some of these neuropathic POTS people, their blood doesn't go up. Like their blood is lying down at 70, and then they stand up, it's still 70, or it drops. So the blood is actually pooling into the legs. And then the nerve system is firing like nobody's business to like get everything back to the head. So they would have loss of sweating in the extremities. They'd have blood pooling, and those are the people that have Raynaud's, or they'd have purple or red feet when they stand. Like they go from lying down to standing, and their legs go red. It's weird.
I have not seen that in clinic yet. That's wild.
I think sometimes it happens, but it's also happening on the inside, and so we don't see like the red on standing. But they'll still, when they're doing their heart rate, you're like, so your heart rate didn't go up. In fact, it went down. Like, that's weird.
Yeah, kind of the opposite, the exact opposite of what your body should be able to do.
Like, I'd like that blood. Like, here, please.
Oh my goodness. Oh,
Yeah.
I can't even imagine what that must feel like to be someone who has that type of sensation in their body. That must be a trip to physically have those symptoms.
Yeah, and a lot of people come in with like light sensitivity, noise sensitivity, and a lot of people aren't functional. Like I had a 17-year-old girl come in, and she looked like she was drunk. Like she had heavy sunglasses on, and it was daytime. But it's, there's lights in the clinic and sunlight comes in, but it's not, Bahamas or hot, like intense light. And so she was like staggering on the walls, and she was like, her balance was off, and then she stumbled into a chair. And then I have a light in my office. I'm like, do you want me to turn the upper lights off and then have the light on? She's like, that's so lovely. And I'm like, yeah, I did this before. I've done this before. And so she came in and she's like, I think I have POTS. And she showed me all her heart rate readings. I'm like, yep. When you go from lying down to standing, her heart went up 45 points. I'm like, yeah, you have POTS. And so her mom is like, just like that. That's yeah, it. She nailed it. Let's just do it. Let's just figure it out. Cause she's 17-year-old, not functional, can't go to school, has been like this for a year, and was previously a A+ student and athletic and, regular happy kid. And now she can't even walk without, holding the walls.
So just, you said something, her pulse went up remarkably, right? Where the last one that we were talking about, their pulse does not go up, or it drops. Now, you were mentioning already in the first one, the hypovolemic, where sometimes salt can start to trick the brain. So then it starts to like basically reset almost in a way, and that's how it's responding physiologically. The second one, where we're talking about things from a herbal perspective to help with adrenaline, and also micronutrients and cofactors and things to help break up adrenaline. But what about for that third one with regards to possibilities of supporting that?
You saw that. You heard that I missed that one, eh?
Yeah,
It's
I did.
tough. Yeah, like
I need to know. That
I'm
was
not
my own
sure.
selfish reasons to be like, Carissa, don't hold out on me.
Like you'll have to invite me back for ... The next. I'm not sure. I'm not sure.
Oh, that one's still tricky, eh?
Yeah, like I think some of these responders you've got to put in venous toning agents. And honestly, there's can we say like supplement names on here? What are we the Wild West, or what do we?
No, well,
No.
I mean, like, we don't have any affiliations with any specific supplements, so it's really up to you if you want to name them. We've dropped names of supplements before, and we just say we don't have an affiliation. So
Okay.
it's, yeah.
I don't think the herbs that we do as naturopaths are great at this. In all honesty, like
For the
I
third,
think,
the third
yeah, like
scenario one.
I feel like we have to use things to tone the venous system, which we like vitamin C and quercetin and bioflavonoids and like the venous tone piece and the neurological venous tone. Like we use lots of B12 injections to innervate the nervous system. We sometimes have to do a restrictive diet to get the nerve system back online. Lots of cofactors, things like glucosamine sulfate sometimes is going to tone the vascular system and give it more juice to like scooch it up. But I do find this one harder. Like I find the neuropathic POTS, and I think everyone has probably like, oh, I have mostly this one, but a little bit of this one, or I'm all three and they're bad. I think usually people have all a little bit of one, or they're, they favor one or the other, but they usually don't have just one.
Right.
So I think this one's hard. So I think,
I was wondering about that. I was like, that doesn't sound as cut and dry to me.
Microcirculation. So sometimes you're looking at like the grapefruit seed extracts, these ones I think are hawthorn and beet crystals to like vasodilate, but also then like scooch at the same time. I find these ones tricky. I find all POTS people tricky, but I think this one is easy. The other two are easy to categorize and track in some ways, because it's all about the with the low blood volume, you put salt in, do you feel better? Oh, you need more. You feel even better. Okay, you need more. You feel even better. Like it's easy to track in that way, like the blood volume. And then the adrenaline piece, it's easy to track as the heart rate. The heart rate is going lower. You feel better. Great. And then this one has not got a great tracker, because the standard diagnosis for POTS for all of them is that the heart rate goes up 30 points on standing. So really, I think there's a subcategory of the neuropathic hypovolemia where people actually have this happening and they're not clear POTS patients because they didn't have the heart rate go up 30 points. Like I think there's an overlay. I think if you're getting people better and the adrenaline and the salt goes down, they look pretty on paper and they're still not quite functional. So you have to do neuropathic POTS stuff, but they actually no longer fall into the clinical criteria of POTS.
Well, that's what I was going to say. It seems completely different from the other two. Very
It
much so.
It is, and it isn't, because it's like still the body's like flows down and then it's got to like hustle to compensate, and the adrenaline goes in and pops the heart rate up. So you're right. I think our stuff is still well suited, but then you're going to look at nerve support, microcirculation, inflammation, and then venous tone are kind of like the subcategories, and every POTS case is different. Every POTS case has a trick. So far, and a lot of them are super sick. So I usually have to do like 3 to 4 visits in, and then we're like, oh, okay, this is gonna work for you. Like, okay, I got it. I got it now.
Do you find that it's typically not, it's not something that's always in I mean, I find most people's health concerns are not in isolation because we're quite complex and we've all accumulated a lot of garbage throughout this lifetime, and stressors and issues and metabolic issues. There's always layers to people's complex chronic conditions. And they come in with on paper being like, I have headaches. And I was like, well, it's because of like these 7 things that are not in alignment in your body. But I mean, with POTS, do you find there's often a lot of other more, it's not like a condition in isolation? Like does it usually come in and they already have other complaints as well, or they've been diagnosed with other things, or can it be something that you kind of see in isolation?
So I think it can be
both.
Both. Yeah. I think there's some cases where you're like mechanically, you're like, oh, it's a low blood volume case, done. Oh, it's a hyperadrenergic case, done. And then oh, let's do some neuropathic one done. And then they go back to being perfect. Like they were
Right.
perfect when they started. And then they go back to being like, this is my life. This is the way it should be. But sometimes POTS does trigger the drama. So I had and I was trying to do my talk and my sister interrupted me and like had my tagline stolen. And so she's not here anymore. But sometimes a chronic infection will rise again. So sometimes you have like, I was a strep responder as a kid. I got strep lots and then I grew up and I out of it. And you get something like COVID and you're like, now the strep is back, but it's having a wild presentation. So instead of getting a sore throat, now you're getting these types of presentation and you really have to get to the root cause, like we always try for naturopathic medicine. And the thing, like a chronic infection like strep, is actually triggering the POTS because POTS is still the body's way of saying something bad is happening. And sometimes that bad thing is still there and you got to fix it. What we have learned is sometimes that bad thing is gone. So I think sometimes when people don't respond typically, like you seem like a low blood volume case, it's not working. Weird. Then we maybe dig into a root cause that still exists. And
Right.
there infections can be dormant and then they wake up. And that has definitely happened.
I see. So it would be fair to say that, I mean, I think you might have touched on this at the beginning, but I just want to be clear for our audience and for my own understanding. POTS is typically almost like a response, like a stress response in some way, shape, or form to the body having to defend itself.
Yeah, I think so. Yeah.
Okay.
And then the POTS and PANS, like PANS is the term for a chronic infection. So POTS and PANS sometimes go together because you get POTS because you have PANS, you have a chronic infection that you're struggling with.
You got to finally use your tagline just for yourself. Congratulations. I was like, I had this moment of pride for you being like, your sister didn't get to steal it from you today.
I know, and then I forgot. I'm like, wait, what was my tagline again? Oh, right. I gotta bring it back in.
Pots and pans, guys.
Pots and
pans. Okay. Yeah. Okay. So it really is, but stealth infections you find can often be one. And that's probably why we had through COVID, we started seeing a little bit more of this, not only from just a emotional stress response, but also stealth pathogens. I remember when I was, the people I sent people for live blood analysis, they found that after COVID infection, a lot of people that they'd already been previously working with would start to get like increased levels of bacteria suddenly showing up in their blood after. So I do know that there's often that kind of, it's almost like these stealth pathogens start coming to the surface again. So I agree with you on that. Maybe that was part of why this became such a thing through COVID.
Yeah, I had two people like separate, like one was like a middle-aged woman and then one was like a 14-year-old man. And both of them had severe POTS and they did great during treatment. And then maybe the fourth or fifth, and then they were stable. They're like, oh, this is great, but I'm on a lot of salt. And then both of them actually had to be hospitalized because they had abscesses. They had actual bacterial abscesses. Once the abscesses were surgically treated, the POTS went away.
So interesting.
So, yeah, I'm not saying everyone has an abscess, but they were really unwell and then who just didn't need the treatment anymore. So that's what, is the treatment resolved? Sometimes the issue is still there and the body's like, no, I'm still mad. And then sometimes the body was like, thank you. I couldn't figure out how to turn the off switch on, but I feel better now.
Right. Sometimes it's still a symptom of a deeper issue.
Yeah.
That's the hard part as us, like where we work is like just finding correctly that deeper issue. Because people are not always forthcoming with what they tell you until you ask the right questions, which could be like you said, 3 to 4 appointments in, and you just be like, have you ever had this? And they're like, yeah, I did as a kid. And you're like, oh man, like how did we not talk about that before?
Oh,
there's only so many things I can fit into an initial visit. I do my best, but still. Yeah. So that's really interesting. Okay. So people's response is relatively good if we're getting it right. But again, it might require that deeper investigation. And then I mean, I guess I feel like I have a question and I almost answered it myself in my own head, but I guess the duration of treatment is really going to be still individualized based on what's really going on.
Yeah, but a lot of POTS cases will be stable after 3 to 4 months. Like they'll be very stable, and then we pull them off. And it's when we can't pull them off that then we know to dig deeper. But usually, I like it. That's why I like it too, because I like it because I'm like, this stuff works. Like almost every time for every person, no matter what the problem is, we have like the treatment itself can be a test. Like, did you respond? Yes. How
Right.
well did you respond? Okay, that's good because you should have responded. It's a, it's a more sure thing than some of the other things we do as naturopaths. So when we're looking at the mechanisms, they typically do respond quite quickly, which is like this is your test. Like, we want it to work. It should work. And so we can tell patients the expectation is this is a great idea. It's a great match, great treatment. Expect really good outcomes. And if it isn't, then we're digging into more things.
Right.
And I like winning. I like having those wins because some cases are so hard, right? Like, we put the work in, the patient puts the work in, and we're like, I don't know. And I feel like this gives us a way into a case where the patient can get a win and feel better and quality of life is better. Or they're in ER every other day and there's no quality of life and they can barely function. And so you can take someone who is really, it's not that they're not in the right spot. And I'm not saying if you have these symptoms, don't go to ER, please go to ER. Make sure you have seen by a cardiologist. But if you've seen by a cardiologist and they're like, your heart is fine, it doesn't mean the vascular system or the vessels are fine. I think this is drama in the vessel system. Still eventually bad for the heart over years, but just it's feeling bad is usually the body is pissed. And then we make them feel better. It's lovely on all sides.
Mm-hmm. Right. I'm glad that you kind of put that out there. I feel like it is important for people to do their due diligence and do get a proper assessment, workup, get the heart checked if you're having these kinds of symptoms. We don't want anything more severe to be missed in the process. But again, if you're coming back and everyone's like, all your tests are fine, maybe go see a naturopath and investigate things a little bit more deeply, or just be working with a naturopath anyways, guys.
We like labs for sure,
no
but
bias.
So P.O.T.S is something that doesn't show up on labs. Like, you look great on paper, and like this 17-year-old girl looked great on paper and she can barely function, but her labs were perfect and they probably would be perfect for the next 10 years. But she's clearly not well. Yeah.
It's crazy. That's where, like, Dave and I have often talked about this. It's always about context. Just because your symptoms say a lot, and you can run all the labs and the labs can quote unquote be within normal limits or reference range. Doesn't mean they're optimal, but it could be within reference range that doctors are not seeing this to be an overt problem. But then it's about context. Like, what else can we do? What can we look at? Because your symptoms are coming up for a reason. We can't just ignore them and just say, okay, bye, see ya. Right. Like, so for this, it really is just about heart rate. It's about pulse.
Yeah. And some of the cases are going to be O2. So some of the cases you would track with a pulse oximeter, you track O2 and heart rate, but a lot of them would be just heart rate. And that's
such a simple thing to run in clinic.
Yeah. Well, old school, index finger, middle finger, pulse, thumb side, pulse. Yeah. It should be per minute, like how many beats per minute, count it up. And then it should be 55 to 75. And if you're at a 120 just seated there, that's not okay.
Yeah. Okay. Awesome. Awesome. Any final remarks that you want to make sure our audience knows about this? I'd love that we had to have this conversation because it was just like, when you started talking about it at the conference, I was like, this makes so much sense for so many people coming into the office with these complaints.
I like it because it makes, like, I was going to go to ER, but I booked with you and you're like, oh crap, maybe you should go to ER instead. I like how this condition just breaks it down. You're like, okay, no, you're in the right spot. I can do this. Yeah. And don't give it very long. Like, but really, if you stabilize really quickly, give it the hypovolemic plan, and then we're going to go to the hyperadrenergic plan, and then we're going to go to the neuropathic plan. So it's good. There's a little quiz you can do too. There's some smart dude, I think I'm not going to say, but there's like lots over the O. What is that? Sweden?
Oh, I don't know.
Anyway, some smart dude, he said that you could do a quiz at a 10 and it's called a Malmo P.O.T.S symptom score. And it's like dizziness, heart palpitations, chest pain, feeling like you're going to faint, memory issues, dyspnea, which is like difficulty breathing, gastrointestinal problems, abnormal tiredness, and nausea, muscle pain, headaches, and insomnia. You count those out, like you're at a 10, get your score, and most people would score pretty high. People with P.O.T.S would have a score of 80. So they, most people would do those. I guess it's the reverse. It's like, how bad are these things? Yeah, chest pain. How bad is the chest pain? So most people would have a score of 14, and then P.O.T.S people would have a score of 80. So sometimes you can actually just say, why would nausea and shortness of breath and insomnia and headaches and dizziness all go together. Okay, they all go together in this term. So a home test is sometimes nice to track it. But other than that's kind of a cool thing. But other than that, POTS is pretty easy to test as a vet in your office, or just send it. I usually send it home for homework. Like, let's do this one. Let's do it's just one of those home tests that I get almost everyone to do.
Yeah. No, that's good. Now, because one final question, actually, I was thinking about this. Because there's a nervous system piece to it too. Do you find that physical support, like osteopathic care, cranial sacral, because a lot of that stuff helps with like parasympathetic response, do you find that could be also an adjunct, or going to see like a chiropractor, making sure the nervous system is happy, healthy, all those kinds of things, or getting that manual therapy? Is that beneficial for these types of things, or just not something you've seen enough of to be able to comment on?
Oh no, for sure. A lot of times they'll say like the osteopath, the chiropractor, the RMT is the only one that puts them back together again. They're just like, I can't, I'm good the next day and then I'm screwed. So they're good. And the physical piece does help the neuropathic piece. It's just if the brain is like, oh, I missed my, like, great, that's where normal is for this moment. But then they slide back to the default that's more inflammatory or makes you feel crappy. Then it's not as sustainable. But definitely reminding the system where normal is can definitely be done by the physical piece too. And the body's so complex, and I'm not as good, and you were talking before, like the things that you like, and I'm like, I'm not as good at certain medicines. Like, I understand the biochemistry piece, where I hated it in high school and university, but apparently now I can't do my job without it. But I think there's lots of ways to leverage the body. Yeah. So I don't know the physical piece because I don't like to touch people. But
I would refer out to that. So, but I do refer a lot of people to osteopaths, or like Dave and I also appreciate visceral manipulation, especially from a digestive organ perspective. I've had some pretty remarkable responses to visceral manipulation and osteopathic care, and it does put people in a more parasympathetic nervous state. And then that can facilitate the healing. It just might not be the only thing, because like you said, it really still is about your brain having a wonky response to normal stimulus now after a certain stress level has been hit, right? Like it's now kind of not calibrated correctly, and we have to almost like recalibrate how the brain reacts. Right? Am I saying that correctly?
Oh yeah, for sure. I mean, when my kids go to their chiropractor, and the chiropractor can like look at them and ask them how they're doing, and then be like, yeah, I pretty much know her C4 is going to be off again. I'm like, how? You're like, how did you? Oh, I can tell because of the way she's answering questions. And I'm like, what? So like,
that's crazy.
Yeah. So like, I think when you know the body, like in your way, definitely you can kind of push out and impact the nervous system, which is, I feel like the nervous system, you're right. I think the nervous system is a beast. So all hands on deck. Yes.
All hands on deck. That's where I was talking to you in our little pre-talk, where I was like, I really feel gravitating towards things like bioenergetic medicine and frequency medicine, because at the end of the day, everything is quantum physics. And funny how you say I hated biochemistry, and that's what you use now. I sucked at physics, but suddenly, apparently, this is where my area of interest is. Like, how did this happen? Like, I don't understand. I'm reading some book called Healing is Voltage, and I'm like, these first 3 chapters are all physics. It's like, God damn it. It's like a nightmare from university for me.
I thought I was done.
I was like, God, it's just going to haunt me for the rest of my life. But it's true. Like, sound has a frequency that affects our internal frequency. Water has a frequency. Like salts and electrolytes are a conductor for electricity in our body. You have to have good water to conduct the electricity. Like, there's all these different moving parts, and, junk music and junk sound causes a nervous system dysregulation, where if you go in nature and you listen to birds, the frequency of their singing actually is more harmonious for our nervous system response. When you start learning about things like this is why nature can be very helpful for us. So that's why I always, it is a much more integrated approach, and the world we live in right now just creates a lot of stress, dysregulation, blue light, like social media stresses. Like, there's just so much that we have to find ways. Even if you don't have POTS, you probably have to regulate your nervous system somehow. Like, I'm just going to put that out there.
I think the last couple of years, I think naturopaths have had a little bit of, I think we're in favor. Like, I think people like us now, and which is nice, but I think there's so much work for us to do. So if we can just like keep employed, keep a paycheck coming in, like keep doing our work, there's tons of work for us to do. We just have to like make sure we don't burn out.
I know that's where we have to also regulate our nervous system. It's like, who's taking care of me and you, Carissa? That's the real question.
That's why I was like, That's why I was like, that's why I was asking. I'm like, what are you doing? Because we have to keep we have to keep you going. Because I'm like, so what
Yeah.
are you doing to keep yourself going?
Yeah. Well, I do drink salt every morning in my water. It's funny enough. I always put some salt and lemon, and I create myself an electrolyte drink to support my adrenal glands because we need salt for our adrenals to wake up in the morning as well. So
I love it. I love it. I know I stumble into the kitchen and before coffee, I like drink a botanical and my kids are, and I'm like, whoa.
yeah. Yeah. My coffee doesn't come until an hour or so after waking. It's like full on hydration first. And my partner has no choice in the matter. He has to follow exactly what I do because I'm the one that makes the coffee. So he doesn't get his until his natural cortisol spike has risen on its own.
I feel bad. I know I feel bad for them, but they're better. And I think, our poor kids, like our partners, like you can hear things that you've said and then they, like 10 years ago parroted and you're like, oh, I don't know if that's good. I'm glad you're in. I just sometimes it's good. It's all good, but
It's all good. Oh
yep,
my goodness.
yep.
Carissa, thank you so much for coming on this episode. And thanks for helping educate our population about POTS because it has definitely exploded in people's awareness. And I just didn't have a name for it before, but I was seeing all these people come into my office being like, what is it? What are we doing? How do we help? A lot of it felt like a nervous system and anxiety response. And that's where I was starting to like work towards. But now I feel like I have a little bit more ability to, decipher things and distinguish things a little bit more specifically to help them, which is fantastic.
Good. I'm glad to be of service. It's fun. I'm obsessed with it, so I'm glad my obsession is not offensive at this moment.
No, it's going to soon become my obsession. I'm going to be messaging you like, guess what?
Like with the energetics. Yeah, you're like, so I have this idea. I'm like, oh, I didn't even go there. That's awesome.
Yeah. All right, everyone. I hope you enjoy this episode. And thanks again, Carissa, for coming on today's show.
Thank you for having me.